We've already massaged all the gums on the inside and the outside of the person's mouth. We included the palate, the vestibules, and the tongue. So now I'm going to throw this used up gauze. It might take several gauze to get that done adequately. The gingiva is complete, and so now I'm going to lean this typodont just into the tray here. Now the person would remain with their mouth open, but our guy doesn't cooperate very well. So I will show you like this. The way that I perform care, and I would like you to perform care, is if you're able, get your solution close to their mouth. This will give you an opportunity to practice with your fulcrums. People that plan on going into dentistry, a fulcrum is something that you'll use through your whole career. So a fulcrum is a great idea. That means that I use my ring finger on the hand that I'm working with, and I place it on the tooth, and then the tool that I'm using can go in and out of each tooth several times because the biofilm of plaque is stubborn, and it takes a while, a little bit of rubbing to get all the way off. It's not just chasing food. We are actually removing biofilm. So the more surfaces that you actually rub-a-dub-dub, the better job you're going to do. So you're going to go around each gum line and between each tooth, dipping as often as possible, continuing around and through. I'm going to get this a little bit closer so that you can better see what's going on here. So if you get around the gum line, if you're able to get up underneath it a little bit and actually apply a little rub-a-dub with the tip of this rubber, you're getting below the gum line. You're pushing in and out, in and out, in and out between the teeth. You're going under the gum line, pushing in and out, underneath the gum line and pushing in and out. So the goal is that you're actually rubbing the surface interproximally between each tooth with the stannous, and you're dipping into the stannous as often as possible. We start on the front teeth with our oral screening, with our stannous saturation on the gingiva, and with the cleaning for many reasons. It's easiest access. It's easiest for the clients to get used to. If you have a client that has some dementia or memory issues or cognitive issues, this is a whole lot easier for them to accept. And the likelihood is that you'll get some of the anteriors completed if they then get tired of what you're doing and you need to stop care. That's okay. Each time we come back, we get a little bit further into the mouth on either side. So we start in the center, going from the central incisor, then the lateral canine premolars and molars. The same with the other side, central, lateral canine premolars and molars. And then the lowers the same way. If you have someone that will open well and you have some access, you can dip your stannous and actually go from the inside. That's a much more difficult situation. As you become more skilled with your tools, you'll be able to do a better job with that. It is possible, but it's much more tricky. So do an incredibly good job from the outside. And if you can access the inside, that's kudos to you. That's awesome. And we'd like you to give that a try. Once you've used the soft pick on all of the hard surfaces, the interproximal spaces everywhere, then you're going to pick up the power brush and you're going to dip your stannous, your brush into the stannous. And again, you're going to start on the front because it's less alarming, and then you go back. I usually warn my client that that brush is going to be turned on. Sometimes it's alarming, so I go, this has power, it's going to be moving, don't be alarmed. They still might jump, and I make sure that my brush head is aimed into the gingiva at a 45-degree angle, and I take my time, go at least 3 seconds on each tooth. If we could dye this plaque and you could actually see how long it takes to remove the plaque, you would be amazed. It is very, very difficult to remove. And this kind of movement, you will not get it done. So slow down, take your time on each tooth, and let it sit. Now, the one thing that will definitely be helpful for you is as you're working with your client, explain to them what you're doing and why you're doing it. This is going to feel odd. Some of them might be feeling like, hey, I brush my own teeth. I don't need someone to do this for me. So it's great for you to be able to explain to them this stannous is prescription. It actually strengthens the teeth, so it prevents decay. And it also kills the germs that cause disease. We're trying to get this solution way up under the gum line so that your teeth will be very, very healthy. We want to stop any disease progression. So you'll go from center to back, same on the inside, center to back on the left, and then on the inside, you'll be going from center to back, again, taking plenty of time with each tooth. 3 seconds, half on the tooth and half on the gum line. I'm starting at center again. 1, 1000, 2, 1003, 1, 1002, 1003, 1, 1002, 1003. Need to dip often because this stuff is good stuff. And now, as you go along, depending on the personality, some people really feel the need to spit. Their saliva gets going and they just really feel like they need to spit. If that's the case, you can absolutely let them use the paper cup here and they can spit a little bit. And then you'll continue. You can assure them too that it's fine for them to swallow as you continue your care. Sometimes that's easier to just coach them. Go ahead and swallow and then we'll continue. So I dip, starting on the bottom. 1, 1002, 1003. Brush is at the gum line. 1, 1002, 1003. 1, 1002, 1003. 1, 1002, 1003. 1, 1002, 1003. I don't want you to rush, and I want you to explain to your clients the importance of this, how good for them it is. We really want them to stay very, very healthy. And you can say, I know this is really tickly, but it's definitely helping your mouth. So we're going nice and slow, continuing to dip as we go. This stuff is just so darn good for your teeth. We want to make sure that you have plenty on each tooth. And every single tooth, 3 seconds. And when all of the teeth have been brushed thoroughly, maybe you noticed we had a quitter. There's a tooth that actually fell out. Yeah, see, that's what we don't want to happen to our clients. But it is, and that's why we're here. So this guy is dead, I guess. We'll put that down. Anyway, so once we've adequately used our power brush on everything, the next thing we're going to do is floss. For flossing, I'm actually going to open this all the way up. And we're going to wait right there. Flossing is a very tricky skill. It does take a lot of dexterity, and I promise each of you will get much better as you go along. You want to wrap the floss around your middle finger, not your first finger, and you want to wrap it in such a way that you don't need any other fingers to hold it. It holds itself. I wrap almost all of it on one side and just a little on the other so that in case I need to move along, I know what direction I'm going in. With this floss that we have, it's actually got a stiff end on one side so that if your client has a bridge, a fake tooth, you can actually thread this stiff floss below the bridge. Now there isn't a bridge here, but this person would be a great candidate for a bridge. A bridge would be a crown on this tooth, a crown on this tooth, and then there's this fake tooth that floats in between that's connected. So if they've got this fake tooth, you need to use your floss underneath it. You thread it under and then pull it through like you're sewing, and you clean the tooth. But this guy doesn't have a bridge, so we're just going to use floss the good old-fashioned way. Now, when you floss, if you use either your thumbs or your fingers or a combination, you can actually carefully go through the teeth, and when you seesaw back and forth and gently put some pressure down, you'll eventually get between the teeth. You don't want to smash into the gums because that would hurt them, but you're going to gently get there. Then you're going to put pressure on the tooth that you're working on, and you're going to go up, down, back, forth, every which way to make sure you're getting all the biofilm off. And then you're going to do the opposite tooth, wrapping tight around the tooth, back, forth, up, down, all the which way, trying to get that biofilm to be released from the surface of the tooth. So every single space, up, down, back, forth, up, down, back, forth. So every single tooth gets that multiple rubs. We want to get as much of the bad biofilm off as possible. Currently, our clients are only being seen about once a week, and because of this, it is super important that we are doing an excellent job, because when we remove this biofilm, it's going to start growing again. And if they aren't seen again for several days, the pathogens definitely mature and become much more pathogenic the longer they go. So the better we can do, the healthier their mouths are going to be. Ideally, when we have adequate number of oral care aides and more volunteers, some people will be seen 4 or 5 times a week, some people 3 times a week, some people 2, and there's some that just once a week will actually be adequate for them. We can establish that based on their own personal care. So this is the basics of doing the client care. But you will all get a chance to do more of this on each other and then on clients. We'll continue to help you as you go. So fear not, and thank you for watching.